Rizan.
Okay. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ikhwan. So I will present in the case today. So our case today was about Abdi, 1 year, 3 months old boy who has been diagnosed with pneumonia when he was 7 months old, was referred from the family clinic at IUM Medical Center to the pediatric ward, SUSMED, with history of rapid breathing for 2 days prior to the
Okay.
admission.
Dong dia. Cerita balik semula. Chief complain apa?
Rapid breathing for 2 days prior to the admission.
Cerita balik lah.
Okay. Chief complaint.
Introduce the patient semula.
Okay. Abdi, 1 year, 3 months old, who has been diagnosed with pneumonia
Tak
during
payah
his
that one. Bukan chronic case. Dia chronic case ke?
No.
Datuk.
Okay. So Abid, 1 year, 3 months old, with history of rapid breathing for 2 days prior to the admission.
Finish. Sudah.
Yes, was referred to the pediatric ward.
Tak payah. Tak perlu benda tu. Semula.
Okay. Abid, 1 year, 3 months old, with history of rapid breathing 2 days prior to the admission.
Sudahlah. Chief complain to rapid breathing or difficulty in breathing for 2 days.
2 days prior to the admission. Yes.
Itu je. Kenapa susah-susah sangat?
Okay.
Chief complain is about chief complain je. Tak payahlah nak refer ke apa ke ni semua
Yes.
Continue
Okay, in the history of presenting illness, actually during he was 7 months old, he was admitted due to the rapid breathing. And
chronic case or acute case?
This is acute case, but it associated with previous.
He diagnosed asthma ke?
Apa dah?
You diagnosed asthma ke?
No.
Dan tu dia nak chronic cases lah oi. Apa diagnosis dia?
Acute recurrent pneumonia.
Recurrent
pneumonia.
Is it chronic case or acute case?
Acute.
Kalau chronic case, you have dia ada diagnosis, about asthma, dia ada apa tu, diabetes, hypertension. That is the chronic case.
Okay. Okay, so 4 days prior to the admission, her mother complained he was weaning and also seemed to be restless and also fever. His body was warm and also noticed to have stuffy nose. Her mother took his temperature several times and it was fluctuating from 38 degrees Celsius to 39 degrees Celsius and noted was worsening at night. The fever is also characterized as persistent. However, it was not associated with chills and rigor. So what her mother do? She brought him to the clinic and the doctor gave him rectal ibuprofen and the temperature reduced to 38 degrees Celsius.
Mak dia tahu ke ibuprofen tu?
Got from the counter in the clinic.
Ibuprofen?
Yes.
Betul
Okay, 2 days prior to the admission, he had sudden onset of rapid breathing with subcostal recession, but not associated with nasal flaring, grunting, coughing, wheezing, and also cyanosis. He had loose appetite as he was no longer tolerate solid food. He also had several episodes of loose stool, but the mother could not tell the frequency of the loose stool. So what her mother do again? Brought him to the clinic and doctor give nebulized salbutamol once and the rapid breathing resolved. Okay, so 1 day prior to the admission, he had second episode of rapid breathing and her mother brought him to the same clinic again and doctor give the nebulized salbutamol once. However, this time rapid breathing not resolved. After that, the clinic referred him to the emergency department in IMC and the doctor give him nebulized salbutamol twice, and alhamdulillah, the breathing was back to normal. Then doctor prescribed him with antibiotic, paracetamol, and also diflam spray. Doctor also give MDI salbutamol 6 puff twice at home, and no triggering factors detected. Okay, so despite of the rapid breathing episodes, his mother claimed that he was still active and still can play like he would normally do. And during that night, after her mother gave him the medication prescribed by the doctor, he had 2 episodes of vomiting. And the content of the vomitus was milk and his medication. The volume of each episode was about half of a cup. And according to her mother, the trigger factor for the vomiting was coughing. Okay, next, the day of admission. He had 1 episode of the rapid breathing
Dalam
and
ward
was,
ni?
huh?
Dalam ward?
Belum. During the day
Okay.
of admission.
Ah.
During the day of admission, he had 1
On
episode
the
of
day of on the day of admission.
on the day of admission, he had 1 episode of the rapid breathing and also was referred from the family clinic at Area Medical Center to the pediatric ward at Area Medical Center for observation and further treatment. Upon further questioning, his mother had family history of eczema, but she denied any history of asthma and also allergic rhinitis. His father had history of recurrent tonsillitis, and he himself, the patient, had a history of eczema when he was newborn. However, he had never been admitted due to this condition. But the mother claimed that he would develop rash on his face after consuming avocado and also tomatoes. On the admission, the patient was alert and active. However, he was still tachypneic.
On admission?
Yes.
HOPI is until the day child masuk ward saja dah tak ada dah. You understand the HOPI or not? Once the
Yes.
patient admitted to the ward, it's no more. It's progress in the ward. It's no more HOPI.
Okay.
You understand or not?
Understand. So during the ward.
During the ward, the one in the ward.
Yes.
You faham tak? Once the child admitted to the ward, it's not anymore HOPI. It is a progress in the ward.
Yes. This according to his mother.
His mother apa?
His mother claimed that he was still active and still can play like he would normally do.
Sekarang you cerita patient tu in the ward ke tak masuk ward lagi?
Before. Yes.
Continue lah. Tak faham tu presentation dulu. Apa tu
That's all for the HOPI.
That's all, finish.
Yes.
HOPI. Ada lagi you want to add about HOPI or not?
For now, no.
No.
Yes.
Aida, any question?
Has the patient come in contact with anyone with the same symptoms like fever recently?
Actually, his parents sent him to the nearby nursery, and her father claimed that in the nursery they have 3 other children who got fever.
Nabila?
I would like to ask the hydration status of the patient.
Hydration status of the patient. The patient was not dehydrated despite her mother.
Apa bukti dia what is the evidence patient not dehydrated?
Okay, despite her mother claim that he has loose stool, from the HOPI, there are no signs and symptoms of dehydration. Yes, he has no dry lips, normal skin sugar, moist mucosa,
That
and
one
also
is
no sunken eyes noted. And
that's
also,
all.
yes,
That's all. No sunken eyes. Nothing else. You know,
if in the general examination, the
we don't go the general examination yet. We just go for history.
okay, yes, no
What's the other
sunken eyes.
evidence? What is the other evidence of the child is not dehydrated?
Other evidence.
Let's say you have decreased you have what to reduce your intake. What the first thing that we will reduce?
Reduce oral intake.
Oral intake, or you become apa tu thirsty, hungry, or you're fasting. What the first thing going to be reduced?
Urine output.
So what about urine output?
Huh?
What about the urine output? No. How old the child?
Normal.
How old the child? The baby umur berapa?
1 year, 1 year, 3 months old.
So how you want to know 1 year, 2 month old the urine output good or not good?
Oh, maybe look at the pampers lah.
Lagi? What you look at the pampers?
Di macam apa? Tengok dia punya pampers tu macam tak leak ke.
Oh, leaking pula. What you have to look for leaking for? What you look at pampers? Anybody?
Urine stain.
Huh? Pardon?
Urine.
Urine apa?
Urine stain.
Urine stain. What you mean by that urine stain? Susahnya bikin logik. You get the thing common sense tau.
We want to assess the quantity of the urine.
Yeah, how you want to know?
If it's like less, if he wet less pampers than usual.
One is the mother will say that they change urine the pampers than usual. The other thing is that what the mother can notice. If you fasting, what the color of your urine?
Darker, more yellow.
More yellowish.
Concentration of the urine.
Lambat dah you all. Tak boleh nak think tau. You need application of your daily life tak boleh nak apply lalu untuk patient. Your group ni. Nasir, any question?
So is there what is the nature of the stool? Loose stool? Is it watery or is there any blood stain?
According to her mother, there was no pale stool noted, and however, he also could not tell the frequency of the stool.
The question is asked about frequency.
Yes, no pale colored stool, no pale colored stool, no mucus or bloody colored stool.
Yeah, it's watery, semi-solid.
Yes,
what?
Watery stool.
Volume? Volume how much?
Volume.
Ah.
Her mother not she did not set the volume of stool.
How many times she pass motion?
Apa dia?
How many times she per day?
Also she did not noted the frequency of the loose stool, but he started 2 days prior to the admission of passing loose stool.
Abdullah, any question?
I would like to ask the nature of the cough. Does the patient have whooping or barking cough?
No whooping or barking cough noted by the mother, but he just the cough is triggers the vomiting.
Amina?
I would like to ask if the patient had any wheezing, and if so, how many episodes?
Actually, there are no episode of wheezing. Yes, for the current admission, there were no episode of wheezing noted by his mother.
Macam mana nak panggil you ni? Rukniyati Husna Mukhtar.
Husna, doktor.
Husna. Apa maksud Rukniyatil Husna ni?
Kekuatan yang baik.
Kekuatan yang baik. Macam ni sebut, macam mana you sebut Rukniyatil apa?
Rukniyatil.
Rukniyatil Husna. Okey, Rukniyatil Husna. Panggil Husna ya?
Husna.
Tu. Okay, Husna, any question?
I would like to ask, is the vomiting severe, and how much is the quantity?
Oh, the vomiting. I think it is a mild episode of vomiting because he only got 2 episodes of vomiting in 24 hours, which are second days prior to the admission. Yes.
What you mean mild vomiting? Bukan tak pernah dengar Ustaz dengar mild vomiting.
It is not severe enough to.
What you mean mild? Yalah, mild memang definition not severe enough. What you mean mild? Is that how you describe? Can you characterize the vomiting?
I referred to one yang BC cancer share tu.
Apa? What's that?
Ada one table BC cancer professional.
Tak payah forget about the table. For you is to able to describe. You see, people don't forget. If you don't mention the table, people don't mention the Bristol, you still going to pass. Faham? It's not important at all. Tapi if you are unable to describe, you're going to fail. People want you able to describe. You don't mention Bristol pun nobody bothers lah. Bristol ni kat tempat lain nobody bothers. You go to USM, you belajar lecture USM, you teach you all Bristol ni. You go ke MU ke UCAM pun tak peduli pun Bristol ni. You belajar, you teaching houseman besok, we don't bother Bristol ni. We want you is able to describe. So you mention is mild. Why is it mild?
Because there were only 2 episodes of vomiting, and
Okay, 2 episodes vomiting. Anything else?
and also the volume. The
Okay,
volume itself just less half a cup.
half a cup. Contain?
Yes.
Contain apa?
Huh?
Apa dia what is the contain? The vomiters to contain what? Consist what?
Oh,
The
contains
vomiters.
medication
Lagi?
that is prescribed by the doctor, and also the milk.
Milk.
Yes.
I think what is the danger? What is the thing that you worry if the vomiters contain what? Even one episode of
If the
vomiting
blood,
also, if it's blood, it can be a severe already.
yes.
So one episode of vomiting, even is bile, considered severe already.
Sorry, doctor.
One episode of vomiting consists of bile. You know bile. It can be considered severe already.
If if the vomiting contains blood or mucus.
Pardon? You dengar tak? You see, episode is one thing. Understand? But what is the content of vomiters is another thing. Even if 2 episode, but all blood, vomit blood, is considered severe already. Or if the vomiting twice consists of bile, it considered severe already. That's why it doesn't matter the volume or what the other things are what they consist of is another thing. So did the vomiters contain of bile or blood?
No.
Then tak boleh mention.
No bile, no blood, no mucus.
Hanis, any question?
Is there any medication prescribed after the first hospitalization for bronchopneumonia for this patient?
Apa dia? Education.
Uh,
Oh, um, as I said, he had been hospitalized before due to the bronchopneumonia. He was given MDI salbutamol and also spacer. And if he had used it 3 times per week, 3 times per day for a week, and after the discharge, and after that he never used it until one day prior to this current admission.
Nabiha?
Patient coming with rapid breathing. So I want to know how is the severity of the rapid breathing?
Well, I think, in my opinion, it is moderate.
Nabiha, I'm asking you now.
Yeah.
No, because you have listened to the history. You have listened to the history. I want you to decide.
Based on the HOPI, I think the patient having mild.
Why you think it's mild?
Because it have first based on the HOPI, he has retract subcostal recession.
Subcostal recession mean mild.
And it can means that it is use the accessory muscles.
So it's mild lah.
It can be no, it can be moderate or severe. Sorry, doctor.
You have to decide mild, moderate, or severe. Which one?
I think it was moderate.
Why you say moderate, not severe?
Because first, infant have feeding difficulties. Means that he doesn't tolerate solid food first. He doesn't tolerate solid food. Means that he has feeding difficulties.
Why it can be severe?
Because if severe, the patient will stop feeding, will not eat, will not eat.
Are you sure? Severe patient don't eat at all.
It stop feeding.
Stop feeding.
Uh,
Where is it your criteria come from? Stop feeding.
I look at severity of acute exacerbation.
Stop feeding. Stop feeding or not tolerate feeding?
It says here stop feeding.
Huh?
It says here if severe, the infant will stop feeding.
Is your infant ke this one?
Toddler. It was in 1 year and 3 months.
Infant 1 year 3 months.
Uh, 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 it was toddler.
So
So having feeding difficulties.
Dia stop feeding tak?
His mother says that he doesn't tolerate solid food and he has loss of appetite.
Huh?
The patient have loose appetite and no
Yeah,
longer.
but then you told me that the severe patient stop feeding.
Yeah.
So stop feeding or not? This child.
No.
What I mean is that is it true or not? This patient is about to severe, mean that severe is stop feeding.
No stop feeding.
Huh?
I'm sorry, I don't quite understand.
You mentioned to me that criteria for severe is stop feeding.
Yes.
Is there anything mentioned about the toddler stop feeding when it's severe?
No, it just said that he doesn't tolerate solid food well.
Tolerate doesn't tolerate. What does it mean? They just stop feeding.
So it means that it was moderate.
So this case, your case about the Ikhwan, they stop solid food stop or not?
No longer tolerate solid food.
So it was moderate.
Why we cannot become severe?
It's because the infant the toddler still eat.
Your Ikhwan, okay, you baca criteria tu.
Yeah.
For the children, what are the criteria? For
Criteria for
food, for taking it orally. First criteria apa? Taking orally apa? Dia kata apa? Depan mata you tu. Ya, udah bihar. You in front of you, you kata criteria for acute asthma tu kan?
Yes.
Okay, apa kriteria dia?
Breathless.
Tak ada, the first one tu, yang you cakap feeding tu.
Oh, the first one mild.
Tak, yang severe tu.
Severe at rest. Infants.
Yes, I know. Doesn't matter. Feeding tu tadi, you sebut feeding tadi. You sebut feeding kan, didn't take orally semua tu kan?
Yes.
Okay, baca balik yang yang feeding tu oral taking orally tu. Apa benda dia cakap? You yang mention kata tak kena take orally. Kalau kriteria for severe. Apa dia tulis kat situ?
At rest, infant stop feeding.
Astagfirullahalazim. Are we talking about infant? Bodohnya. This 1 year 3 month infant ke?
Toddler.
Baca apa toddler dia tulis apa toddler tu? Toddler dia tulis apa? Anything written about toddler or not? About
I'm sorry, but you just says that breathless at rest.
Ah, dia mention about feeding tak, toddler?
No.
Ah, so why you say is child is moderate?
I made a mistake rather.
Ah, so you think mild, moderate or severe? Baca balik, mild apa? You read all, mild sampai habis.
Mild, the patient will breathless when walking, talk in sentences, alertness may be agitated, it have normal to mildly respiratory rate, increase, the accessory muscle usage is absent, and it has moderate wheezing, and the SpO2 on air is more than 95%, and the pulse per minute is less than 100, and the PEFR is more than 80%.
Moderate?
Moderate, if the patient when talking, breathlessness when talking, if infant they have a feeding difficulties, it will talk in phrases, the patient will usually agitated, we have increased respiratory rate, there are present of accessory muscle usage, moderate, and then the wheezing will be loud, and the SpO2 on air is 92 to 95%, and the pulse per minute will become 100 to 120, and
severe?
the severe, the patient will be breathlessness at rest. If infant, it will become stop feeding, and they will talk in words, they will be usually agitated, and the respiratory rate will markedly increase, and they will be present of accessory muscle usage and severe, and there will be the wheezing will be usually loud, and the SpO2 will be less than 92%, and the pulse per minute is more than 120 per minute if more than 5 years old, and more than 160 per minute if infants.
Ikhwan, go through the symptoms of your patient.
Symptoms. He has fever.
Yeah,
he has tachypnea.
We are talking about the. Can you go one by one or not? Aduh, susahnya lah. First one apa Nabila?
Breathless.
Breathless. Your patient breathless macam mana?
Tachypnea. Rapid breathing.
Toilet apply. Nabila, semula breathless apa? Baca balik kalau breathless.
Kalau mild, breathless when walking, kalau moderate, breathless when talking, and kalau severe, breathless at rest.
Your patient mana satu?
Macam mana cakap?
Semula Nabila.
Ulang balik.
Ulang balik sampai dia faham. Ikut okey
Breathless kalau mild when walking, moderate when talking, and severe breathless at rest.
The patient got breathless when talking.
Biasa when talking.
Yes. So moderate.
Lagi feeding itu? Nabiha?
If infant they will have feeding difficulties, but this patient was toddler.
Yang second criteria?
Talks talks in. So if mild, they will talk in sentence. If moderate, they will talk in phrases, and if severe, it will talk in words.
Your patient?
Yeah, patient still can talk in sentences.
1 year 2 month old, talk in sentences. Wow, pandainya budak anak you.
Yeah. Sorry, she did not mention anything about this about
Yeah,
about
yeah, of course lah. 1 year 2 month, what you expected? 1 year 2 month, they can speak only 1 word, 2 words here. Nabiha lagi ha.
Alertness, mild may be agitated, moderate usually agitated, and severe usually agitated.
She's still alert and
Mild lah.
conscious.
Tak agitated. You tahu tak agitated means what?
Crying.
Yes.
Tak senang duduk.
Mild. Dia mean dia tak agitated lalu. Relax je.
Yes.
The child not agitated lalu.
Despite rapid breathing, she's still alert and conscious.
Baca balik Nabiha.
Alertness, mild may be agitated, moderate usually agitated, severe usually agitated.
You found that agitated. Agitated dia still alert tau.
Yes.
Tapi agitated means what? You make her agitated dia tak alert.
No, agitated is alert.
Itu. So your patient apa?
Agitated.
Agitated. Why you say your patient agitated?
Yes. There are no drowsy or confused, or the patient still can play like he normally do.
You know what agitated tu apa? Tell me what agitated means.
Nervousness.
Anybody? Apa tu agitated?
Restless.
Restless. Mungkin lah, tapi apa better words agitated? Buka Google kan. Agitated apa? Baca agitated.
Worried.
Agitated, worried. Google cakap apa? Worried.
Saya Google.
Dia tulis apa? Worried.
To make someone feel worried or angry.
Angry, Kalau budak tu dia macam mana kalau agitated, kalau worried, angry, apa, how they going to behave?
Meragam.
Lagi apa dia akan ni?
Nangis.
You come near already they will cry, let nobody be near. That's agitated means. Lagi the third one apa lagi?
Respiratory rate, mild, normal to mild increase, if moderate increase, if severe markedly increase.
Ikuan, your case.
On vital sign, the respiratory rate 41 breath per minute.
Most of the time you come, patient already dah day 1, day 2 dah admission. Faham?
This one is during the day of admission, during first day of admission.
Tapi by the time you clerk the case, the student clerk the case, patient already on treatment. Rarely you come and see the patient before the treatment was started. But when the mother describe, how the mother describe the breathing?
She just described rapid breathing. She did not. I mean, she did not count or any other complaint.
Yes, doctor.
Anything else?
wheezing. No, accessory muscle usage.
Dia macam mana Ikhwan?
Yes, this patient have subcostal recession.
Subcostal only, no intercostal dan
Subcostal only.
okay, Nabila, anything else?
I think that's all.
That's all. What's the important sign of the child is not severe?
SpO2.
SpO2, if you can do, you cannot do SpO2, what you can see? Kata patient, ada cyanosis?
No cyanosis.
No.
So Sabrina, what do you think? The child mild, moderate or severe?
I think the patient is moderate
Why you say so?
because of subcostal recession. The presence.
Can you start from started all over again tak? Nak go all along. Letih tu mengajar you all tau. Kita dah ajar step by step tu masih macam tu lagi.
Okay, for breathlessness, the patient is breathless when talking. And then the patient is agitated. The respiratory rate of the patient is also increased. There is also presence of accessory muscle usage due to subcostal recession. Yeah, that is from what.
Itu je. Ada lagi kan?
The pulse rate of the patient.
Aduh, sustihnya lah. You kat mana tadi discussion tadi? Apa the last one? Nabiha?
There are no cyanosis.
You tak dengar ke discussion tadi? Tak masuk dalam otak? Sikit punya lama nak ajar benda macam tu, tak dapat lagi. Dia suruh berfikir tau. Difficultnya nak suruh berfikir. You see, for the history, is enough information already to decide. But you have to know how to analyze the history. That's what we call analyze the history. Nabila. Tell me the essence of the case. So before that, anybody else any history tak? Nak tanya. Anyone else to ask? Anything else to ask? Ikwan, tell me the last admission though. Your first admission though. Tak dengar. Dengar tak? Tak dengar Ikwan.
Sorry, I am muted.
Okay, dengar. What the first admission lah?
During admission, he had one episode of rapid breathing. And referred from the
lah, what the first admission all about?
During the
umur berapa masuk, kenapa masuk?
During he was 7 months old, he was admitted due to the rapid breathing and also associated with wheezing. And at that time, he was only admitted for 1 night without any intubation or intensive care unit, and it was treated as bronchopneumonia. And yeah,
Then after that,
and doctor give antibiotic during that, and doctor also prescribed with MDI salbutamol and spacer for him to use 3 times, and he had used it 3 times per day for a week after the discharge. And after that, he never used it until this current admission.
Nabila,
Yes, Doctor.
you think the first admission, second admission ni related or not related?
Yes.
Huh?
Yes.
Okay, if you think related, why you think possibly related?
Because it could be recurrent
What?
pneumonia.
So how they related? You think you pelik ke budak ada 2 pneumonia per year? Is something abnormal? If you think related, what's the thing that you think that related?
The child is immunodeficient.
What's the evidence immunodeficient from the history?
Oh, there's no sign of infection, right?
On the sign pula, we do go for sign, we give a symptom bago. If you think the child is immunodeficiency because the second and first, what's the evidence from history?
The child is not compliant to medication.
You see, you told me that probably immunodeficiency. So my question to you is, what is the evidence for the from history that the child is immunodeficiency? Apa medication dia pakai pun, tak ada medication pun dia pakai kan?
Not.
So what's the evidence of the child is how you say there's connection? If you're talking about, you suggest immunodeficiency. Okay, now tell me what's in the history that you think that the child is immunodeficiency.
The child have 2 severe pneumonia in a year.
We don't know this pneumonia or not.
Okay. Presence of eczema.
Presence of eczema, you think because presence of eczema, the child is immunodeficiency. Can you give me the diagnosis of eczema can cause immunodeficiency? That can cause eczema?
Hyperimmunoglobulin IgE syndrome.
Apa tu?
The rash immunodeficiency syndrome that may present with an eczematous dermatitis.
What we call that?
Primary immunodeficiency.
Mak dia ada eczema tak? Parent ada eczema Ikhwan?
Mak dia ada.
Yes.
Don't you think that the eczema is more related to the atopic?
Oh, atopic dermatitis.
Mother got eczema. No, if you think the child if just is immunodeficiency, the eczema is the evidence, what else you look at? Because mother got eczema.
Yes.
Hakim, what do you think?
The primary the previous.
You think the first the first admission and second admission related or not related?
In my opinion, it is not related.
Why you say so?
First, because the patient has finished the medication, and then the gap between the hospitalization, which is 8 months, right? Ikhwan?
Yes.
The gap? The first hospitalization at what?
She did not mention. Yes, she did not mention, but just treated as bronchopneumonia.
At what age?
7 months old.
7. So the gap is quite long, like 8 months. So I don't think it will be a recurrent pneumonia, in my opinion. So that's the second
So
reason.
8 months to what you want to look at to tell you that actually there is not related.
If there is any episodes of infection between those two periods.
Kalau infection dia masuk ward balik, sama lah. Okay lah, not that frequent, twice. Maybe you can say that. But what other thing you want to look at?
What I think?
Okay, if it's related, where you want to put it? Let's say it's related. You think it's related, Likuan. Where you want to put it? In HOPI ke past medical history? Tak dengar lah, hui.
HOPI.
If it's not related, where you going to put it?
Past medical history.
You understand or not now? Where you want to present that thing? If you think it's related, you must give the reason why you think it's related. If you think not related, then you give the reason why you think it's not related. You think everything must has a reason, tau. Mungkin you are too inexperienced yet. No. To decide is related or not related. But the rules are like that. If you think it's related, it's going to be in the HOPI. If you think it's not related, it will be in the past medical history. Husna, what the essence of this case? Your group ni slow tau tak? Letih. Nak go through one by one. Itu baru bagi history tau. Analyze the history.
A 1 year old 3 months old, 1 year, 3 months old is having a rapid bleeding and it's presented with
Tak merapu dah. Okey, Hamdan ha. Hanis ha. Hanis, what you ni? Essence of the case.
Rapid breathing.
Yeah, repeat reading. How you make it in sentence?
Patient, 1 year old, 10 months, presenting to the INC with rapid breathing.
Apa tak dengar? Apa you cakap? 1 year?
The patient, 1 year, 3 months old, comes to the INC with rapid breathing.
1 year, 3 month old who was having shortness of breath.
Shortness of breath.
What the thing come to your mind after that?
Any other associated symptoms like cough and also
Nabiha, what the thing come to your mind? This is a 1 year, 3 month old girl kan, who having the
Boy.
shortness of breath. Boy, 1 year, 3 month old boy having shortness of breath.
Causes of the rapid breathing?
Causes rapid breathing. List me the causes.
Can be bronchopneumonia.
Lagi?
Can be acute bronchitis.
Lagi?
It can be viral group.
Stroke. Okay lagi
Also can be asthma.
Lagi?
It can also be upper respiratory tract infection.
Such as UTI ni banyak tau.
Banyak.
It can be rhinitis, acute pharyngitis, acute tonsillitis, semua tu acute infection lah.
It also can be pneumonia.
You mention already kan pneumonia kan? You dah mention dah. Anything else?
I think
Aminah, what do you think?
That
You tahu shortness of breath tau. Shortness of breath is very common now. You must able to know the cause tau. Ni cause pun tak tahu, basic things tau. Tak tahu the cause.
Would think of bronchitis, asthma,
Mention already.
pneumonia.
Afiq?
Yes, Doctor. Acute epiglottitis.
Okay, lagi?
Heart failure.
Lagi?
UTI due to streptococcus infection.
Apa benda tu? This no diagnosis UTI tau. Or streptococcus infection. You have to decide, is it rhinitis, is it a pharyngitis, or is it a tonsillitis? Sabrina, Aida, do you think the patient got heart failure or not?
Yeah. we do not get the info from Equine, I think.
I'm asking you. You
Um,
see, I already asked
but
you, I give you chance to ask question. There's a reason why I give you chance to ask question. Because when you want to ask question, is I want you to think about the case, what the possible, then ask the questions, relevant questions. That's the reason I ask question. Bukan suka main ask questions. Now you already finish asking question. For me, when you complete asking question, the finish asking question, you know everything about the case anymore. You should know the case, everything about the case. Now I'm asking you, because you already finished asking question. The child is having possibility the child is having heart failure or not? If yes, why? If not, why?
In the history, there is we do not know that the patient there is no chest pain or
1
top
year, 3 month old asking chest pain. This 1 year, 3 month old, faham tak? You think 1 year, 3 month old bercakap sakit dada?
Maybe there is no ankle edema because we know from the history that the patient is active and still play.
Yeah, is it? You mean mal ankle edema, dia kena walk around? The many people who mal ankle edema can walk running. Ikram already told you all the sign and symptom already. What is the sign symptom? Probably heart failure. What is the sign symptom? The symptoms probably not the heart failure.
For signs and symptoms that may show heart failure is tachypnea. But
Okay, tachypnea. Okay, heart failure can have tachypnea. Anything else? Nabila?
Yes, doctor. Fatigue. Fatigue.
Fatigue. Siapa fatigue? Budak ni fatigue?
Budak.
Ikram, your patient fatigue ke?
She still can play well.
So, no cyanosis.
Heart failure coming with cyanosis.
Lack of appetite.
Okay. Decrease appetite lagi. So do you think the child got heart failure?
No.
Why you say it's not heart failure?
Because
Hakim. You think the child got epiglottitis ke?
Sorry, doctor?
You think the child got epiglottitis ke?
Epiglottitis.
Epiglottitis. You think the child got epiglottitis tak?
I think not, because
Why?
epiglottitis, the patient look alert, does not look toxic.
Okay.
And then he does not present with any dysphagia.
Itu je.
The patient does not stop feeding.
Okay, anything else? Husna, you think the patient got croup or not?
No, because from no cough, or especially for
Patient
school.
got cough what? Equal patient ada cough tak?
The cough is just
Patient got cough or
yeah,
doesn't
it
have
has
cough?
but just
Now, answer my question. The child got cough or not? If the child got a cough or not? Yes or no?
no cough.
Patient have no cough at all.
No cough. Yes.
Okay.
Just triggering episode of vomiting. Cough just triggered the vomiting.
Astaghfirullahaladzim. You know my question tak? Answer
No
my
cough.
question. No cough.
No
Tapi
cough.
patient vomiting because of cough.
Oh, sorry.
Huh?
He had cough.
Aduh, letihnya lah. You kan masuk lawyer court mati lah you. Kena pusing lawyer je. Twisted lawyer mati. You can twisted lawyer, twisted you like nobody business. Patient ada cough.
What I mean is no barking cough.
Okay
Because in group, the most appropriate symptom we want to see is
anything
barking
else?
cough.
More important than barking cough.
No inspiratory stridor.
Patient have no stridor. Hamnis, you think patient acidosis or not?
Pardon, doktor?
You think the patient has acidosis or not?
Acidosis.
You see patient acidosis can also cause tachypnea apa?
It might be.
My question,
acidosis.
this not might be. My question to you is, the patient acidosis or not? Yes or no? If yes, why? If no, why?
I think no, because this patient has rapid bleeding with
You mean acidosis don't have
fever.
rapid bleeding?
Yes. Yes.
No, you're not. Your problem is, one, unable to analyze history. Number two, you don't know you don't know the causes of shortness of breath in children. That's your problem. You know where the shortness of breath, the knowledge of shortness of breath come from? Will be in the
books and internet.
Or internet. That's the reason you read the books and internet. Because you want to solve your patient problem. The third thing, you don't have that knowledge of the basic knowledge. Acidosis, heart failure, basic knowledge, heart failure in children, heart failure in infant, toddler. Number three, you are able to use your knowledge, look at the patient history, and try to see synchronize to see what is it. What is what? The history pointed to what? Why history is not? Why the history show this one? Why history doesn't show exclude the other one? Yeah, it's your logical exclusion thinking process. But you are unable to discuss. I said to you, oh, is it heart failure or not? You are unable. Yes, the patient got shortness of breath. The patient got a difficult feeding intolerance, but patient don't have any evidence of exercise intolerance, PND, autopnea. Patient don't have any known case of cardiac problem before. See, all the things are so difficult ke? Is it difficult? Itu about history. You rasa benda tu perlu intelligent ke? Very intelligent person ke to get all these things? Mesti very intelligent. Doesn't need intelligent. You need somebody who is smart, who can think logically, common sense. How you to get all those things? That kind of thinking process. This is what we call clinical thinking. How you to get all these things?
Books.
Books won't help you. Apa?
Brain.
Pardon?
Clear with patient.
If you clerk 5 patients, you think like that. Somebody clerk 2 patients and think like that. Who going to become more better clinical thinking? Who clerk 5 patients ke who clerk 2 patients?
5 patients.
That's the answer. Practice make it perfect and practice the thinking. But you see, you clerk saja tapi you don't think, analyze the history, tak guna juga. Somebody can clerk 3 cases but he can analyze the history. Is better than those who clerk 5 patients who didn't unable to clerk this, analyze the history. Any question? Any question? Tak ada? Sudah pergi smile the whole. Okay.
Thank you, Doctor.
Thank you, Doctor.
Yeah, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Okay, doctor.
Recorded. Bye. Good luck. Good luck pula.
Bye.
Good job.
Good job. Assalamualaikum.